I'm Niall Geoghegan. I'm a licensed clinical psychologist, and I work with people in person, by phone, and by Skype. My reason for making this video? Basically, people can only get so much of an idea of what it would actually be like to work with me from reading the text on my website and looking at my photos. So even though being interviewed on camera feels a bit odd, it's really the best way to give people an idea of what I'm really like. It also gives me a chance to speak to some of the questions that often come up during the free initial consultations that I do with people. For example, one thing that comes up since I talk about how quickly coherence therapy can bring about change is that some people will come to me saying, you know, I'm not just looking for short-term therapy to fix a particular problem. I'm looking for a therapist to guide me through a much longer-term process of personal or perhaps even spiritual growth. And there's sometimes concerns with an emphasis on achieving results quickly or on the possibility of therapy being time-limited may not be compatible with those broader or deeper goals. So I should be clear that the work I do is equally effective in the context of short-term or ongoing therapy. The important thing about coherence therapy is just that it's a directed and focused way of working, and at a very deep level. That direction and focus allow us to stay on track and progress towards a particular goal at any given time. The point is that when I'm working with you, we're not just engaged in a random or directionless exploration of your experience. Every insight that arises will get funneled through the lens of the particular goal of change that we've identified as what needs to happen next. So part of my job is to help you identify exactly what that change is that you want to bring about in each session. And then of course the other part is to get right to the core of what's blocking or limiting your ability to make that change. That orientation is equally important in short or long-term work. In other words, no matter what it is that you want out of therapy, you're going to benefit most if every single session achieves progress towards the particular change you're wanting to make happen. What type of client am I a particularly good fit for? I'll tell you, I love it when people come to me saying, I've been trying, either on my own or through some other type of therapy, to change my behavior or change my experience in some way. I've been working on it, I've gained insight about it, but I still don't seem to be able to change it. Whatever that change may be that you're wanting to bring about, what I hear in that is, yes, there's clearly a part of you that desperately wants things to change because the way things are now is causing you suffering. That's the part of yourself that you're consciously identified with. That's what brings you into therapy. But if that's all there was to you, you would have already gone ahead and made the change. The fact that change keeps not happening indicates that there must also be another part of you, a part you're perhaps less aware of, perhaps even not at all aware of, and that part's not on board with you making this change. And apparently that part of you has been in control up till now. So what we've got to do is get in touch with what's driving that part. What is it within you that's not letting you change? This is where therapy gets really interesting, not just for me, but for the client as well, because rather than just explore that question by discussing it in a heady or cognitive way, I work experientially, and what that does is it bypasses the rational part of the mind that we're usually identified with. You know, as much as we like to believe that that part of our mind runs the show, the truth is we all have a much deeper felt sense of reality, and that's what really determines what we experience and how we behave. And most of the time we're surprisingly out of touch with what's true for us at that deep felt sense level. So in order to find out what's blocking change for you, we've got to engage and understand that part of you. Once we tap into that and integrate it with your everyday conscious sense of self, change just follows naturally. My door is always open. Whether you can come and see me here in Berkeley or far enough away that it would make more sense to work with me by phone or by Skype, just contact me for a free initial consultation and we'll see how I can help. I look forward to hearing from you.